It's actually HDMI 2. It's one of the PCs. That one. You may have to move the mouse. Try the other one.
It's the other one. There's an actual PC behind the TV.
I guess it's just you and me.
It's the other end.
For his laptop, he needs to select the other one.
I'm hoping we'll probably get to that, but Saturday's
There's a lot of stuff.
Yeah, I don't. It just says window pops up and says installation. And, you know, that's after you've done a half hour. So one of the things that happens is to download it, install it, installation. The computer will shut off and restart several times. It goes through that phase and it never shuts off. Look at my progress. It's a bit like your wife probably is the one.
That's good. Great way out.
You got a 64-bit
Yeah. All right, guys, I will get started so we can stay on time. But I am not a speaker to preface, so bear with me. And then if you were here earlier this morning, you heard all this already. But my name is Hailey Hammond, and I will be talking about special educational needs, and specifically the behavioral side of autism. So who am I? I went to the University of Cincinnati. I got my undergraduate in psychology with a minor in criminal justice. And then I got my master's degree in behavior analysis. I am currently a clinic manager at a behavioral center in Cincinnati. I work with children ages 2 to 22 years old diagnosed with autism and other developmental disabilities. What exactly do? I collect, analyze, and graph data, create treatment plans, write IEPs and ETRs, and run various assessments. The types of data we collect typically includes behavior data, how frequent and how long a student is engaging in a certain behavior. We also collect data of acquisition skills. These skills can include academic, social, gross motor skills, etc. And then I also have meetings with parents to discuss progress, questions, and concerns. I got married in 2020 to my lovely assistant. This is James. We had a very small COVID wedding in Michelle's backyard, so that was fun. And I'm a proud dog mom to Rocky Road and Kylie Quinn. So what is autism? Autism spectrum disorder is a developmental disability caused by differences in the brain. Autism can look different across each individual. The amount of support needed ranges hence the spectrum. Individuals with autism often have difficulties with social communication, interactions, and restrictive or repetitive behaviors. An autism diagnosis by a professional can be conducted at age 2. So there are some kiddos who may require various augmentative devices, so PECs or tablets, to communicate because they have limited or no vocal language. Most of the children in my center engage in various forms of maladaptive behaviors, such as aggression, property destruction, self-interest behaviors, which could include hitting their head with their fists, biting themselves. I've come home many times telling James stories of how I've had desks thrown at me, or I've gotten punched in the face, or dragged to the ground by my hair. Pretty intense stuff. However, I've also worked with some kiddos who are completely vocal, and are working on geography and multiplication skills and flying through their programs weekly, and I'm struggling to keep up with giving them new stuff to work on. All that to say, the range of students I see and work with who have autism vary in their behaviors and rate of skill mastery. So what can ASD look like? So with deficits in social communication and interaction skills, this can include avoidant eye contact, unresponsive to their own name, lack of facial expressions, little interest in social engagement with others, minimal use of social gestures such as waving hello and goodbye. They don't typically hit the milestones of other neurotypical peers at the same rate. They may just need additional support, accommodations, and or time to learn these skills. So these are all skills I worked on with some of my kiddos, such as like providing eye contact when someone's speaking to them, identifying facial expressions and emotions of others, imitating gross and fine motor skills, and so on. So with restrictive or repetitive behaviors and interests, this can look like lining up objects, repeating words or phrases over and over, flapping their hands, rocking their body, walking or pacing on their toes, spinning themselves. They can get upset with minor changes in their schedule or routine, have obsessive interest, and sensitivities to various sounds, smells, tastes, looks, or feels. So one of the kids I work with, he likes to line up small objects or toys and then look really close and just kind of watch them. Some examples of repetitive behaviors or words or phrases I've seen. One of my current kiddos, he loves quoting facts about bugs. So I could probably name a few facts about bugs if you're curious. But he'll, what we call script this is just repeat or quote just different facts he knows. Or he'll say different phrases like, Miss Haley says there's no screaming at school, and he'll randomly say that, and I'm like, you're not wrong. But haven't said that to you in a few weeks. So it's just the funniest stuff sometimes. I've had some students just show obsessive interest in TV shows and movies like SpongeBob or Barney or Moana. I can't tell you how many times I've gone home and I'm singing the Moana soundtrack. It's ridiculous. And then with sensitivities to sounds, smells, taste, looks, or feels, we have children who seek extra forms of touch, so like pressure, squeezes on their arm, weighted blankets or weighted vest, fidget toys, headphones to help with excessive sound, so just meeting their various sensory needs the best way we can. So after diagnosis, the emotional impact on the parents can look like sadness or grief, fear or worry, stress, which could be financial stress or just family dynamic, and then anger and frustration. Many parents begin to feel these after diagnosis. With grief, the parents may grieve the dreams and potential plans they had for their child. A parent might have fear and worry that their child might not live a full and happy life, that they won't make friends, or that they won't be able to experience the same opportunities others have. These are all very valid feelings. When able, early intervention is so important in order to work on any skill deficits. So various treatments for autism include behavioral treatment, so ABA, developmental treatment, so occupational therapy, speech therapy, educational therapy, social relational, which focuses on improving social and emotional skills, pharmacological, so medication. There are no medications that treat or cure autism, but there are medications that aid in other conditions, such as anxiety and depression, or symptoms such as SIB, which is that self-interest behavior, inability to focus, high energy levels, etc., and then psychological, so working with a psychologist or therapist. I will be mainly focusing on the behavioral treatment, so ABA. So what is ABA? ABA is an evidence-based science that focuses on the treatment of socially significant behaviors. Progress on goals is tracked and measured. The goal is to decrease problem behaviors, increase language and communication skills, improve attention, social, and academic skills. This can be one-on-one or in a group setting, can be provided in the home, school, or community, and then prioritizes the use of reinforcement and less restrictive practices. So as far as social significant behaviors or goals goes, these are goals that are going to improve just the life of the person. So I've had many parents who may want their kid to know the capitals of the U.S. or I don't know, their colors or shapes, which are all cool and interesting facts to know, but we come in with kids who aren't even potty trained and they're 10 years old or don't know just like life skills like washing your hands or how to shower independently. So those are the goals we really want to focus on first, making sure they have those baseline skills before we focus on maybe the more academic skills. So one story I have, I was working with a 3 or 4-year-old a few years ago, and we were working on his fine motor skills. We had a little ring stacker, so you just had to stack the rings. We were working on this for months. He could not do it without me kind of prompting him or guiding him. But there was one day I presented it to him, and he stacked all the rings all by himself, and I literally just bursted out crying. It was just so cool, and I was so excited that he did it. He did it all by himself, and it was amazing, and probably the best part of my job is just seeing my kiddos. I call them my kiddos because I'm with them 8 hours a day, but just seeing them succeed and learn and just build different skills is really awesome. So how to get individualized care. Talk with your child's primary care provider, get a diagnosis, talk with your school district, schedule an ETR meeting or an IEP meeting, and then look into various accommodations that the school may provide to students with special needs. So the difference between an ETR and an IEP, really quick. So with the ETR, that comes first. A school or center will evaluate the student's needs for special education services. An ETR is then created, which is just a summary of the evaluation. A meeting is scheduled to determine if the child qualifies for services. If the student does qualify, an IEP is created. ETRs expires every 3 years, but they can be modified as needed. So with the IEP, it is designed to meet the unique needs of the individual. It highlights the student's current strengths, needs, goals, and services, and they expire every year. So how to support? Oops, sorry, missed a slide. Transitioning to adulthood. So we developed a transition plan with the school district and other team members. So this may be the BCBA, the SLP, the OT, the doctor, and obviously the students' parents. What will the child's adult life include? So this may include college. This could include employment, housing and residential support, which can be funded by public and private sources, support, supervised and group home living and care facilities. Under the Individuals with Disability Education Act, a child with disabilities can receive special education through 22 years old. So like I said before, my center, we take kids 2 to 22. Or the student can continue living at home with their parents. So some organizations and businesses will hire individuals with disabilities to work a few days a week or for a few hours. These jobs can include being a cashier at a restaurant, a bagger or shelf stocker at a grocery store. I told the story earlier this morning, but one of my kids, we came back from summer break this past school year, and he got a job working at a mechanic. I don't know what exactly he did, but when I saw him, he was so excited, like, Miss Hailey, I got a job this summer. And I was like, what? Like, tell me about it. And he was just so happy to just have that experience. What else did I want to say? Sorry. Yes, and as I said before, with the center, we take kids up to 22 years old. We try to work on vocational skills around 12 to 14 if they're able to, and then work on those transition skills and those goals as they approach their 18th birthday, just to kind of get them ready for adulthood. So how to support. If you're a parent, be their biggest advocate. Ask a lot of questions, be inclusive, implement what your child is learning at school in the home environment. Help to educate those around you about your child's diagnosis and what their needs are. Be patient and know that you're a rock star. From my experience, it's hard for parents to see very many significant changes at home that we might be seeing at the center, so it's important to generalize those skills across environments. With being inclusive, bring the child along with you for various family outings if able. One of the kids on my caseload, my director came in and she said that he wasn't going to be here Thursday, Friday, and then Monday and Tuesday this coming week, and I was like, oh no. Sometimes our kids get hospitalized, so I was like, what happened? She's like, no, Dad just went to take him to Disney, and I was like, oh, like beautiful. So I just know he's having a blast, and we'll see him again on Wednesday, but just include them in everything you do, and then be patient. For a lot of the kiddos with disability, it may take them longer to learn new skills, but keep working on it with them. And then my last slide, how to support if you're a family member or friend. Offer support with your actions. How can I help you? What do you need? Be a listening ear, be inclusive, and engage with the child with the diagnosis, and do your own research and learn about it. When I have meetings with parents, oftentimes you can tell they just need to vent and rant and just express any frustrations or concerns. So just be a listening ear and validate their feelings. Be that person for them. That is all I have for you. Thank you.